and welcome to this edition of The People's Voice with Shabnam Palesa Mohamed, broadcasting from South Africa for SPM Media. It's Saturday, the 21st of August 2021. And before I introduce our stimulating topic and our brilliant guest, remember to share this broadcast, video and conversation across all your platforms, because we've got to beat the censorship, especially when we're dealing with topics that challenge the status quo. So our topic today, of course, is the harassment of healthcare workers in South Africa and the impact on your right to health. Let's give a very warm welcome to Dr. Ivan Jardine. Thank you for joining us on The People's Voice.
Hi, Shabnam. Thanks for having me on your show.
Absolute pleasure. Dr. Jardine, let's start here. Why did you decide to practice medicine? What is it that you do and what are you passionate about?
Well, when I finished matric, I had a couple of choices. I love teaching. I was thinking of doing being a teacher, and my dad actually wanted to do medicine, but my grandfather died at the age of 12. So he had to come back from Hong Kong at the age of 12 to bring up the family. So he really had a tough life, and he wanted to do medicine and he couldn't. So his wish was for me to do medicine. So I had other interests. If I didn't do medicine, I would probably have done music, as you know. I love my music. Anyway, I ended up doing medicine. And just to cut a long story short, my dad had obstructive sleep apnea and snoring. And during my internship, he passed with a massive bleed in the midbrain. And I was going to do medicine and treat hypertension, but eventually I followed my passion. And I was doing ear, nose, and throat surgery because I love my music. I thought I could treat musicians and treat the vocal cords, and it never worked out that way. But now I know why I've done ENT, because now I'm finding a lot of effects on sleep apnea and snoring, and that's where my passion lies, is to help people breathe better through their noses. So I ended up loving sticking my business up people's noses.
Yeah, that is a beautiful story, and I hope you write a book about it someday. I mean, to know why you entered medicine, it's certainly a very beautiful and very meaningful story. So you're an ENT specialist and surgeon, right?
Yes, that's correct. Yeah.
All right. And what are you passionate about? We know you're passionate about music. What else are you passionate about?
Well, I'm passionate about. I'm just going to turn my camera down here. I'm passionate about making a difference while I'm alive. And during the course of my my private practice, I saw the HIV was a huge scourge, and was crime and a whole lot of stuff at the handover. And I started an organization called the AIDS Army. It stands for Armed with Information for Our Daughters and Sons. And I went around schools as many as I could. I actually knocked on doors and actually tried to kick down doors myself sometimes, and spoke to the principal and try to give the children information that whatever the government tells you to do or says you can do doesn't mean that it's right for you and good for you. Because I was trying to warn them to stop thinking about sex and thinking about their future. And until they're adults, then they can make the mistakes and nobody can. But while they're still in the informative stage, they should learn good habits, because there is a saying that if you teach a child in the way he should go, when he's grown, he will not deviate from the path. So if we teach them the wrong things from the beginning, when they grow up, they're just going to be falling on the habits that they grew up as a child, you know. And anyhow, then it landed up going through to several stages of different issues of child abuse and anything on HIV. And we landed up, I ended up realizing that the environment that they're living in is not quite ideal, because most of them go to school hungry and they come back home hungry. So we started a food program called Mission I Am Possible. And perhaps in the next phase, we'd like to talk about Project Possible, because through the hashtag Project Possible, Project Planted Forward, and the last one is hashtag One Less Hungry Child, maybe we can still make a difference. Because I've got a letter from one of the schools that the kids were having disruptive behavior and stealing things from each other. And eventually, when we had some of our champions plant a veggie school there in a school in Soweto, Mweni, their school marks went up from 30% to 70%. The disruptive behavior stopped. They started playing chess and football and started winning trophies for the school. And I think it's every parent's dream to have their children do well at school. And I think as part of the COVID, because a lot of people are getting depressed with COVID and people losing their jobs, I think that should be something we can look at, as an addendum to the alternative treatment and boosting your own immune system, to healthy lifestyle, planting a veggie garden. When you get your hands in the soil, the immune system gets, you boost your immune system that way, and working in the sunshine, etc., etc.
Multiple benefits to growing food, right? From your health to your physical health to your mental health to food sovereignty. Absolutely love it.
Everything.
And we're going to dive more into those topics with you in subsequent conversations. But for today, we want to talk about what happened to you a couple of weeks back that set many of us across the country reeling in shock and really angry because you were arrested while out trying to treat a patient who was sick. Can you take us through your experience on that evening, Dr. Jardine, when you got the call or you got the message that someone was ill and needed your help? What did you think about? Did you think, I've got to leave immediately? Did you start to think about the regulations? Take us through what happened.
Okay, so in a nutshell, my cousin stayed about 45, 50 minutes away from me. And he texted me, he said, Mom hasn't had been able to eat for 2-3 days, and I think they were tested positive for COVID, so they had to give her medication. And he said she hadn't been able to swallow for about 2-3 days and getting dehydrated. Can suggest someone to help put up a drip. So I said, well, maybe the GP or the nursing qualified nurse can help put up a drip. Then late in the afternoon, he texted, said I couldn't find anybody, so I had to rush out to get there. So I came to my office. I found what I could. And I dashed off and got to him by about 8 o'clock. And we needed those the needles. We went to Flora Clinic, and we found some of the drips. And by the time I finished, it was just after 9 o'clock. And he wanted to have a little chat and coffee, but because of the curfew, I decided to rush back. And he understood as well, because I think better go back because the curfew is at 9 o'clock at that time. And yeah, I reached between Eastgate, between the Park Meadows and Eastgate on the bridge. And this car drove right up my tailgated me. I couldn't even see the headlights. And I thought, is this, because of crime and everything, it could be a hijacker. So I edged off past the red traffic light. And then the blue lights came on, and these two officers, male and female, parked right in front of me and got out of the car and asked me what I was doing. And they demanded to see a permit. And I had an old permit from the hospital, but unfortunately didn't have my name on. I had my driver's license and my credit cards to identify myself. I didn't have any other form of identification. And then I phoned my friends. I phoned the works manager here at the hospital, and phoned the PRO, and they all identified who I was, and but he wouldn't listen. Just wouldn't listen. Without a permit.
What were they saying to you, and what was going through your mind at that time?
Well, I tried to keep calm because I thought, well, maybe here comes trouble, and and the thing is, no matter how I tried to persuade him, I was quite close to my office, and I said, please, I'm just down the road from my office. Come to my office. I'll show you all my credentials, show you all my equipment. I'll show you who I am. And he just refused. It wasn't even less than 5 minutes away from where I was arrested. So anyway, eventually he threatened twice. He said, stop phoning now. Do you want me to physically grab you out of the car and arrest you? And eventually he said, where's your driver's license? I gave him my driver's license. He grabbed my driver's license. He said, follow me. So anyhow, I followed him, and close to the police station, he turned into a dark road. I'm not sure why. I just carried on straight and met him at the police station. And he took me in to take a statement. And then I had phone calls from people who were praying for me and trying to talk to him and saying, look, we know this doctor, he's a doctor there. And they just wouldn't listen. They said it's too late. And even the station commander in charge that night couldn't do anything. Tried to call him. So anyhow.
What did he tell you were being charged with, Dr. Jardine? What was the
I didn't have a permit
that you made? You didn't have a permit.
I didn't have a permit.
If I remember correctly, couple of months ago, the president of this country said that discretion should be applied when it comes to lockdown regulations. And of course, we know they're always talking about the respect we have for our healthcare workers. So what are your thoughts on that? Could he have applied any sort of discretion? What do you think was the agenda?
Look, it didn't come out, but he was just adamant he wanted to arrest me. I'm not sure. I cannot say anything, but I don't know if he was looking for a bribe or something. I don't know, but it didn't hint anything to me at that stage. But he just said it's too late. We started the case. They could have crossed it out and say wrongful arrest and then let me go.
Right.
So
what happened at the station? What were your observations? What happened next?
So ahead of me was a chiropractor who they were taking statements from as well. And they were busy writing out statements. And in the meantime, I was busy calling this one and calling that one and trying to see if we can get up, because I didn't want to get locked up behind bars. And I think probably was about 45 minutes or an hour after that. When they finished, they took us both in and locked us up in the cell. Now, he's got, the chiropractor apparently had his own reasons for being there. Also curfew, I think, breaking curfew regulation. And anyway, we were both locked up in there. And then a short while later, 3 gentlemen came in. Apparently they belonged to the community police forum. And they were patrolling a looting or something in Jewel Street here in Malvern, and they got arrested too. And one of them had a business fixing up police cars as well.
Wow.
Okay. And
the absolute irony.
Yeah.
What were the conditions like? What were the conditions like inside the cell?
Well, it was a 3x4 cell, and the cell door, maybe a good thing that it was open to where the police office was. It was just behind one of their desks, so they could see what's happening in the cell. And perhaps I'm grateful in a way that they didn't have hardened criminals that they arrested in the same cell as me. But everyone that was arrested, including the other 2 that came later, had broken curfew regulations, and they all had their own reasons. So inside of the 3x4 cell, there were 2 benches we could sit on, no place to sleep. There was a basin there. And some things that I witnessed there really troubled me, Shabnam. This one particular person had diabetes and said, I'm feeling ill, sick, I need my medication. And they said, in their language, what he interpreted to me, he said, you can die. And I said, but I'm sick, I need my medication. He said, well, if you collapse, then we'll call the ambulance. And then I sat and I said, for heaven's sake, the guy's not well, he needs medication. Let him out. And after about 3 hours, I think it was, they let him out to his car because his eyelids were drooping and you can see he was getting a bit groggy. And well, if he collapsed there, what could I do? I couldn't do anything. So
his vehicle was there in the parking lot with his medication, and they let him out 3 hours later.
It's about 3 hours, and he was starting to droop, and then he brought something back to eat, and the tablet escorted him, and then he started perking up again. So and then for myself, I told them my bladder's bursting, and I just looked there, and only about 15-20 minutes later, they escorted me to the washroom. So
were they busy? Was it a busy night? I mean, what do you think would lead to this lack of interest?
They were busy filling in. Yeah, they were filling in forms and filling in books. I'm not sure what they were doing. And there was 1 or 2 that were busy on their cell phones. But anyway, then he got interrogated, and I was left with the 3. Eventually, it came to my turn, and there was a detective. His name's Chabalala, interviewed me for about an hour, took my fingerprints, and I thought the bail was set at 500 Rand, and he told me, no, the bail set at 2,000 Rand. So I came out before I went in, I had one of the lawyers from the ACTP call me, and I said, well, I can't speak because the captain said I couldn't use the phone. And he said, no, you've got a right to talk to a lawyer. But anyway, I had a phone in my hand, and I said to the captain, because he had his hand, he said, bring me that phone now. He's speaking to me. So I gave it to him, and he switched it off. I didn't talk to him at all. Put it into the cupboard, and then, so I just started singing in the prison. Literally, just to keep myself sane. I started singing. just to keep me sane. Anyhow, so
Right.
he came to Martin, and when they set the bell at about, I think it was around about 2 o'clock. I might be getting my times a bit off, but it's a while later they said not 500 Rand, it's 2,000 Rand. You've got 2,000 Rand cash. I said, I've got a credit card. You got 2,000 Rand cash. You can go. If not, then you have to stay till in the morning. In the meantime, the manager of the hospital phoned to speak to the police there and said who I was, and they still wouldn't listen. My friend offered to bring me a blanket, and they said, sure, you can bring a blanket, but you'll be somebody arrested for breaking curfew rules. So they couldn't even bring me a blanket because my knees were cold. Lucky I had a warm jacket on, but my legs were really cold. So I had to try to get some sleep lying on the wall and just pace up and down. And then the other three came and we were just chatting. And then they got taken for interview and had the fingerprints taken, I think. But I think they had the bail, so they paid the bail and they left. And then another two guys came. Apparently he had a restaurant in Sandton, and he was closing up, cashing up at 8 o'clock, but his car wasn't working. That's what he told me. So I'm just basing on what he said. And he phoned his friend to come fetch him. And of course, by the time the friend came, he was past the curfew hours. And so he arrested both of them. Now, one of the other things was they left I think she was pregnant, but she was a bit inebriated outside for a few hours in the cold, freezing cold outside because his wife was waiting outside. And he was saying, look, please, he called him my brother because one was from Zambia, one was from Malawi. He said, let my brother go. It's not my fault. It's not his fault. He came to help me. I got him into this mess. So let him go because he's got young children at home, unsupervised. Please let him go home. They begged for hours for them and they just wouldn't listen.
Wow.
So in the meantime,
I start to think about the rationality of the curfew in the first place, almost as if the virus is not active after 9 p.m. It makes absolutely no sense. What happened next?
No, well, I think they've got a very intelligent virus. You know, when you set the clock to 9 o'clock curfew, after 9 it goes, and then 4 o'clock it was back in the corner. Anyhow.
Right.
I've got a comment to say on that just now. But anyhow, so they just wouldn't listen to him. And eventually I said to him, this poor lady, put her in the office. It's ice cold outside, you know. And then they brought her in, but she was a bit, they were talking to each other. Anyhow, so eventually I was texting and eventually at 7 o'clock, one of my friends came to pay my bail for me. At 1,000, 4 o'clock they said 1,000 Rand. You pay 1,000 Rand and you can go. So anyway, so I spent the whole night there, and one of my friends came to pay the 1,000 Rand, and I left at 8 o'clock. And Daryl and Clinton came to visit me. Daryl came all the way from Pretoria. I was very, very grateful to see me and see how we were. So that's how then I left. So I spent 10 hours in prison. It's quite an experience.
Absolutely insane. I mean, you know a lot of people and you had a lot of support. I mean,
thank you for supporting as well, for your support.
No, of course, absolutely. Like many people, I was absolutely outraged that you had been arrested and there was this refusal to apply common sense discretion with a healthcare worker primarily. And so, of course, we took it to Twitter and to the various Telegram groups and said, this is what's happened. Here's his photograph. Here's Dr. Jardine in jail after having treated someone who was sick. And of course, there was massive outrage and the word really spread quick and fast. Can you tell us something about the public support that you got? What were people saying? What were people's reactions like?
I think, Shabda, thank you to you setting off the fire because I'm so grateful for all the support that came through. It was so encouraging. I even had a grade 3 pupil at one of the schools bake a chocolate cake for me. She brought it to my office. Yeah, it was. And my mom read about the article. She wanted to bake a chocolate cake for me. It was really very delicious. the support. And one of my patients came and dropped some money in the envelope to help with the bail. So I've really had, and the support, even just posting and hearing all the posting, and everybody was really totally disgusted what happened.
That's the prevailing opinion that we saw in the Twitter spaces as well, which is quite an influential space. But 9 out of 10 people were absolutely outraged. You would get the odd person who would say, well, he should have been listening to the regulations anyway. But where to from here, Dr. Jardine? What happens to other healthcare workers? Are they also being harassed over this lockdown? I would imagine that's true.
Yeah, well, just to clarify one thing, on an emergency, we don't need a permit. And I refuse to, if I can't find my permit when I'm called out, I'm going to go without a permit. And the reality is we don't need a permit. We don't need a permit in an emergency. So I agree, of course, we have to identify ourselves, but now in the days of Google, you can Google anybody, you can confirm the identification anytime. Don't have to be stubborn like that. And so I don't believe I'm the only one that's been like this. And since then, I've heard stories of all my other colleagues and even nurses being arrested as well. And just freshly now, there was a pediatrician going to Linksfield on Club Street, and she had a baby that I think she was bleeding, but some emergency at 3 o'clock in the morning. The police stopped her as well and refused everything. They tried to find something that she didn't have. So she had a permit. She had an ID card. She had an ID book with a barcode. And they said, "Have you got the HSPCA card with you?" She said, "Well, I can download it. I can show it to you." No, they wanted a printed version. So they were adamant on finding something that she didn't have. And she said, "I'm going to a hospital for an emergency. This kid is bleeding." I mean, who would come out at 3 o'clock in the morning in the cold weather if it's not an emergency?
Absolutely. I mean, did they let her go? Was she arrested?
So
what happened to the child?
Eventually they let her go, and thank God the child was okay. So in my case, I was coming back from an emergency, and she was going to an emergency. That illustrated the point that I spoke to the policeman. I said, "Look, what if I was going towards an emergency and they arrest me and they stop me like this?" And luckily, I didn't have to go and see anybody after that, when I got arrested. But she got arrested. Right. Apparently, one of the policemen there was quite amenable and was almost ready to let her go. But this other guy was totally, excuse the language, but hard-ass about the whole thing. And
she had a permit. You didn't have a permit. She had a permit, and they were still looking for the reason
something to ID her, to try to harass her. Yeah. And
so they wanted to arrest, they wanted to charge her, and they wanted her to pay bail.
Well, I don't think they didn't arrest her, but they wanted form of ID, and eventually they let her go. She said, "Follow me to the hospital. I'm not far from the hospital," and they wouldn't follow her. And the several issues that have come up here, Shab, because I think number one is people have to realize, and on a personal basis, I mean, we had a patient with an airway problem that I got involved with yesterday, and we just worked on it for about an hour or so, and she stabilized a bit. And this morning I was going to go and change a tube, and sadly she died in the early hours of the morning. I was completely wiped out. And I'm not dealing with so many patients in the front line. So can you imagine the nurses and the doctors are treating with COVID that are dying, and every death has an impact on you. And all the frontline workers are already traumatized from their work, from watching people die, watching their families and watching their colleagues die. We're already traumatized. Why are the policemen picking on us to harass us and to make it even worse for us? Because now she's quite traumatized. She didn't want to really come out to speak because she's concerned about, obviously, her family and everything like that, which I don't blame her. But I feel now that we connected and we made this here now, we have to make these things public. And in fact, I'd like to maybe set up a line where any doctor, any healthcare worker, any frontline worker has been harassed by the police. Let's make cases of this, and we can write to the Minister of Police and demand an apology, number one. Number two is to make a blanket statement to say if they cannot find a permit, as long as it's a genuine emergency and they can identify themselves, let them go. Even maybe escort them if they're really into an emergency. And if
Right.
If it can be shown that it's a fraud, well, then take the consequences of fraud. You know what I'm saying? And I don't think,
Right. And
I don't think, pardon?
that process shouldn't even take longer than 5 minutes. If the
Yeah,
person you're stopping says, look, I'm a doctor, here's my ID, here's where I work, here's where I'm
yeah.
off to, you're welcome to follow me. That
Well,
shouldn't take longer than 5 minutes because it's somebody's life that's in danger. But what's
yes,
happened since? Has there been any engagement with the station? Has the minister reached out in any way? Has
no,
the president said anything about the harassment of healthcare workers?
no. I've had great support from the Private Practice Practitioner Association, from HPCSA, from SAMA, from my own ENT Society. I all had great support from them. They were writing letters and things like that as well. And now the thing is, that's number one. Number two is, I think if they really cared about the patient, because the bottom line is the patient, we're not out in the cold middle of the night for fun. You know what I'm saying? And she was dressed up in a scrub. She had a stethoscope. She had all identification of who she was, and yet they still harassed her. So, and I'm sure there are many, many cases in, countrywide that are being our colleagues are being harassed like that. You know. So, but I think now we have to all stand up together because we're all fighting. And I said to the station before, I said, you know what? First of all, if the same situation arises and I can't find my permit, you better get used to arresting me because I want to do it again. I'm not going to ask permission in an emergency. I mean, no government, no policeman can stop anyone, any doctor or anyone tending to an emergency. We trained, and that's what we have to do. The second question I asked as well was, what if I was going out for one of their family members? Would they have arrested me? And the obvious answer would be no. So they're going to have, I think they haven't been trained to have some empathy, some sympathy and humanity, and use their common sense and discretion, as you said, to see who is a criminal and who's not. I mean, the guys were investigating looting in Jewel Street, and they didn't arrest anybody. That whole night, all the guys that were arrested were curfew breakers for their own reason. And they had a reason for breaking the curfew. By all means, find the guy if they want to, but don't arrest them and put them in jail. So the other thing that the other thing I was concerned about was they rescued me from getting COVID in the streets. And then they stuck me in the 3x4 cell where I could get COVID from somebody else. I mean, totally insane.
Right.
There wasn't sanitizing.
That's a very caring, it's a very caring police station, and it's a very caring government. Lockdown is to save lives, unless you're actually out there to save lives. Right?
Yeah, exactly. And then, I mean, but if they want to, I think there's something I have to highlight to the Minister of Police and Minister of Health, that if they want to arrest people from breaking the curfew laws, then at least make sure the cells are COVID compliant. You know, with sanitize and have social distancing, and if they don't have masks, give them a mask or something. But don't just throw everybody in together just because they broke the curfew. You know what I mean? And there are criminals out there that are looting, that are stealing, and not one of them that were arrested that night was a criminal. And perhaps, as I said, maybe I'm grateful for that because that was the whole thing. So anyhow, I had to pay the bail and then appear in court. At court, they wanted legal representation, so they delayed it another. We spent the whole morning waiting for the prosecutors at the Edenvale court, and they by 12 o'clock, like spent the whole day there. I had to postpone an emergency, so the whole time because someone had a bleeding nose. I had to postpone that. Just tell them, can you hang on and see what you can do until I get back to the office? Anyway, they just said, well, you said to appear in court by the 5th of August. So nothing I could do. We had to prepare our cases and everything. And on the day of the 5th of August, about 10 o'clock, I think we got called in. I had to make an appearance. And they called me in, and I stood there in front of the magistrate. She was busy checking the pages and everything. And I think it was a police lady or prosecutor gave me a thumbs up and said I could go. Didn't even say hi to me. I didn't say good morning on or nothing. So I could go. So they dropped the case. So to me, it's kind of, I mean, I could have done better things with my time. We're all busy people. Even though there's COVID, we need to do things and get things done for the office and, things like that. So now...
I mean, a violation of various constitutional rights, your right to dignity, of course, your Hippocratic oath that you're sworn to protect patients, the right to health of those patients. They just dropped the case. What do you think happened? Do you think somebody spoke to the Minister of Justice, the Minister of Police? Do you think the magistrate applied common sense, discretion, and empathy? What do you think happened?
They didn't tell me anything now, so we got to find out. And
Right.
and I think that all of us, not only me, all of us, an apology for violating our rights and traumatizing us further in this traumatic period. I mean, people are committing suicide. People are losing their jobs. It's already bad enough time. They do not have to apply draconian laws. But, for heaven's sake, have some kind of heart and humanity and feel sorry for people and find out exactly what happened. I mean, of course, there are criminal elements. And, I believe this. Anyway, maybe I shouldn't say it, but I believe there's a place where some other activities are happening all night and nobody gets arrested. Yeah. That's all I'm going to say.
Well, that's true. I was about to say, if only as much energy was applied into child abuse, gender-based violence, murders,
absolutely.
All of those issues in our country, this country would be a very different place. So where to from here, Dr. Jardine? What happens next?
Okay, so now I'm just looking at legal counsel where we can go further from here. And I'm busy compiling letters now to the station commander and the Minister of Health and Minister of Police as well. And I'm going to send an open letter and have it delivered to their offices as well. Because I feel now I'm giving the voice now, and I think I have to speak up for my colleagues. I have to stand up for my colleagues. I cannot allow them to traumatize us even further. Because we're already under a lot of stress now. And a lot of doctors in private practice are a lot of stress. And I feel sorry for the doctors here where I am, the Bedford Gardens Hospital I am, the doctors that are treating COVID. And every patient, you put your whole heart and soul into, more than 120% in, and you give everything you have. And unfortunately, some of them still die, and that has an incredible bad toll on you, So we're already in not a good space already. And if the police should have empathy on us, and if it is an emergency, escort us to the emergency. Flash your blue lights and let us go through whatever, guide us through to the red traffic lights and just get to the emergency so we can at least help somebody sooner, And
that's the honorable thing to do. And Dr. Jardine, may I also mention, of course, a very obvious point that needs a reminder, and that's that our courts are overburdened.
Already,
and so therefore, we should not be clogging up that system any further with the arrest of healthcare workers who are on their way to a medical situation. That simply should not be happening. In fact, I think it would be a good idea to copy your letter to the Minister of Justice as well, who needs to issue a directive to the prosecutors on matters like these. So you saying that healthcare workers who are being harassed, will they be able to contact you somehow to draft this statement or draft this petition and make sure that we get the necessary statements, announcements, and directives from the relevant people?
Well, if they like to, they can send me an email. I think probably email would be the best. Can I give out my email address?
Absolutely.
Okay, it's IJ, lowercase, 9988 at yahoo.com. They pop in an email, just pass me the story, and if they want to remain anonymous, they can just put the anonymous, or they can just pop me an email, and I can copy all those, because I don't think I'm the only one that they've done this to. And it just happened that the social media caught fire that evening in the morning, and but I think now
I would agree with you. I agree with you. There's certainly more, and exactly, your story is going to bring forward others, and the implications are bigger than just COVID-19. It's the clampdown on doctors' autonomy during this lockdown, where if there is no resistance to that, it's going to continue beyond this COVID-19 chapter. What is your message then to healthcare workers and to the public who are impacted by these draconian measures?
At the spur of the moment, I myself confess, I only took the guy's name. I didn't get the lady's name. And everyone is so traumatized and shocked that they might be arrested. And that's like a very traumatic feeling already. But I think we should find out exactly who the officers are, and maybe they should provide their identification as well. Ask the arresting officers what their identifications are, and maybe take a picture of their ID and a picture of their vehicle, and then you deal with them. And also, we all have to stand together, because we are providing an essential service to the public, and the public needs us. we're there for them. We're not, we're doing our best for everybody, and sometimes we can't help everybody, but we give everybody the best that we can, and we don't need this kind of harassment and trauma to one of my colleagues actually confessed that in order to get out of the situation, he had to give him a couple of notes to let him go. So, but the thing is, they all have their families, they all have everybody waiting for them, and they've got somebody to go and take care of, and so the thing is, they have to come clean now and stop harassing the innocent people, and even assist us. We're all in this together. I mean, we went to honor the police station and the good policemen there, everybody there. We went there the one morning about 6 weeks ago. We went to pray them. We gave them some Bibles and we honored them. We gave them badges. You're serving heroes, and we really honor you. We want to pray for your safety and just be strong, and we know tough times are here for you. And yeah, that's what they do to us. And I'm going to go back and do the same thing again too. But the thing is, I think there are a lot of good policemen. I have to say that too. And there are probably the odd few that are circulating around that's giving them a bad name. And they have to be disciplined.
Absolutely. And certainly empathy, discretion, and common sense needs to be part of the training, but there needs to be accountability, and it's got to come from the top. The last thing we want is a headline in the newspaper or on the radio, on the TV, that a patient died because a police officer obstructed, intimidated, or harassed a healthcare worker. Because that would bring absolute pandemonium to this country, and it's not something that we can afford. Any closing thoughts from you, Dr. Jardine?
And that would be one life too many. Well, and the closing thoughts is, look, I think we have to bring them to book, whoever's overstepping their mark. And I think the policemen have to be issued a blanket statement to say, look, if a doctor identifies himself, or a healthcare worker, nurse, or a sister, or somebody, let them go. If they are in an ultra emergency, escort them to the venue. And if they prove that they are committing fraud, well, by all means, then charge them. I mean, you can't. I don't want to encourage anyone to break the curfew laws, but there are certain exceptions. Now, even if you commit the worst crime, and that's to murder somebody, there are extenuating and mitigating circumstances. If you're doing it under self-defense, that's a totally different punishment or course of events than if you actually contemplate murder. So why does it not apply to COVID? And I think the Minister of Health and the Department of Police Service have to come together and make sure things are this, rather than harass us, support us, because we support them. If it was one of their families members that we're attending to, we would attend them exactly the same urgency as any other patient. So let's work together, because we're all facing tough times. And the second thing is, they are not losing any salary. They're getting the same salary every month. So they don't have those kind of issues to worry about, and rather, catch the real criminals and focus on that. And we'll be supporting them right behind them all the way,
Absolutely. A powerful closing message there. Common sense one from Dr. Ivan Jardine, sharing his story of being arrested for trying to save a human being's life. If you're a healthcare worker out there and you've been harassed, contact Dr. Ivan Jardine. Make your voice heard. Stand up for yourself and the right of your patients. Dr. Jardine, thank you for joining us today on The People's Voice and for being a voice for the people.
Thanks for having me. Have a good evening. Thank you. Have a good night.
Thank you very much. Remember to share this broadcast across all of your platforms and ask yourself every day, what am I doing to make my city, my country, and my world a better place? Until the next edition of The People's Voice, Revolutionary Peace. Goodbye. Take care.